Hey everyone.
So we are here to discuss our topic, which is medication effects on swallowing. So our first article was Diagnosis and Clinical Course of Unexplained Dysphagia. And it was found through an in-depth chart review and also further studies using the video fluoroscopic study that there were 3 patients in this study that came back with abnormal swallowing, and the diagnosis was drug-induced dysphagia with polypharmacy. And they also, through the in-depth chart review, found that these patients were taking anticholinergic medication, which affects the esophagus and also causes xerostomia.
So the second article that we annotated specifically relates to cardiac patients. There were 576 participants, and they were 18 and older, and they were currently getting their medications filled at the hospital where the study took place. There were 3 goals for the research article, but 2 of them specifically relate to our topic. So the ones that relate were how does polypharmacy relate to dysphagia, and then the researchers wanted to elaborate more on how polypharmacy relates to the 2 types of dysphagia. And so the results found, they gathered their results from questionnaires that the participants filled out. So the results found that patients who take more than 5 medications are at a high risk of developing drug-induced dysphagia, rather than someone who takes less than 5 medications. And so then another note that they found was that female cardiac patients have an even higher risk of developing drug-induced dysphagia. And then it also found that esophageal dysphagia is more common in polypharmacy than oropharyngeal dysphagia. And we have a list of medications on our handout for you guys to refer back to.
Yep. And so our last research article focused on xerostomia and hyposalivation. As we know, xerostomia is dry mouth, and hyposalivation is a reduction in salivary secretion. So this study compared patients who had hypertension to patients who had no hypertension and were on no medication. The patients who had the diagnosis were on an antihypertensive medication. And they studied these patients by giving a unstimulated and stimulated salivary flow rate test and also a questionnaire. From the questionnaire, the findings were that the patients on medication came back saying that they always had a feeling of dry mouth, and they also found that the patients on medication had a lower salivary rate, meaning they had hypersalivation or xerostomia.
And so how can we as SLPs help with this issue? Well, first we can take a look at the patient's case history and see what types and how many medications they're currently taking. And also we can collaborate with pharmacists and other physicians and basically try to get the number of medications that these patients are on down.
Thank you.